We share our world with a vast array of creatures, from tiny insects to majestic elephants. This incredible biodiversity enriches our planet in countless ways. However, it also presents us with a hidden danger: zoonotic diseases. These diseases can jump from animals to humans, causing illness and even death. Understanding these diseases is crucial for protecting ourselves and future generations. By learning about zoonotic diseases, we can better prepare for and mitigate their impact. Zoonotic diseases are infectious diseases transmitted from animals to humans. They are caused by pathogens like viruses, bacteria, parasites, and fungi. Transmission occurs through various routes. Direct contact with infected animals or their environments can lead to infection. Indirect transmission can occur through vectors like mosquitoes, ticks, or fleas. Consuming contaminated animal products can also lead to infection. Human activities disrupting ecosystems increase contact between humans and wildlife. The Black Death, a devastating pandemic in the 14th century, serves as a chilling reminder of zoonotic diseases. Caused by Yersinia pestis, it spread through trade routes. Fleas on rodents like rats carried the bacteria. The Black Death killed an estimated 75 to 200 million people. It spread rapidly through overcrowded and unsanitary conditions. The pandemic led to widespread fear, social upheaval, and economic decline. Ebola virus disease, first identified in 1976, is a severe and often fatal illness. The virus is believed to be carried by fruit bats, which transmit it to other animals, such as primates. Humans can become infected through contact with infected animals or their bodily fluids. Ebola outbreaks typically occur in remote areas of Central and West Africa, where human populations are in close proximity to wildlife habitats. The virus causes severe hemorrhagic fever, characterized by fever, muscle pain, vomiting, diarrhea, and internal and external bleeding. Ebola has a high fatality rate, ranging from 25% to 90%, depending on the strain and access to healthcare. The virus spreads through direct contact with infected individuals or their bodily fluids, making healthcare workers particularly vulnerable. Outbreaks of Ebola virus disease have had devastating consequences for affected communities. They have strained healthcare systems, disrupted economies, and caused widespread fear and stigma. Section 5, COVID-19, a stark reminder of our interconnectedness. The COVID-19 pandemic, caused by the SARS-CoV-2 virus, has brought the world to a standstill. This novel coronavirus, first identified in Wuhan, China in late 2019, is believed to have originated in bats and spilled over to humans through an intermediate animal host. COVID-19 has spread rapidly across the globe, causing millions of cases and deaths. The virus primarily spreads through respiratory droplets released when an infected person coughs, sneezes, or talks. Symptoms of COVID-19 vary widely, ranging from mild cold-like symptoms to severe respiratory illness. The pandemic has overwhelmed healthcare systems, disrupted economies, and led to unprecedented social and economic restrictions. The COVID-19 pandemic has highlighted the interconnectedness of our world and the speed at which zoonotic diseases can emerge and spread globally. It has also underscored the importance of public health measures such as mask wearing, social distancing, and vaccination in controlling outbreaks. Section 6. The ripple effect: zoonotic diseases and their impact. Zoonotic diseases have far-reaching consequences that extend beyond individual cases of illness. They can impact entire communities, economies, and global health security. The ripple effect of these diseases can be felt in various aspects of our lives. Outbreaks of zoonotic diseases can overwhelm healthcare systems, particularly in resource-limited settings. The sudden surge in demand for medical care, coupled with the need for specialized treatment and isolation facilities, can strain healthcare infrastructure and personnel. These diseases can also disrupt economies. Travel restrictions, quarantines, and business closures, implemented to control outbreaks, can lead to significant economic losses. The agricultural industry, particularly livestock production, can be severely affected by outbreaks of animal diseases that threaten food security. Zoonotic diseases can also have social and psychological impacts. Fear, stigma, and discrimination associated with these diseases can lead to social isolation, mental health issues, and the breakdown of community trust. Section 7. Understanding the enemy, the importance of studying zoonotic diseases. Studying zoonotic diseases is crucial for protecting human and animal health. By understanding these diseases, their origins, and how they spread, we can develop effective strategies for prevention, control, and treatment. Scientists working in various disciplines, including epidemiology, virology, ecology, and veterinary medicine, collaborate to unravel the complexities of zoonotic diseases. They conduct surveillance to monitor disease trends, identify potential threats, and track the emergence of new pathogens. Researchers study animal populations, their habitats, and their interactions with humans to understand the factors that contribute to spillover events. They investigate the genetic makeup of pathogens to track their evolution and develop diagnostic tools and vaccines. Understanding the ecological and social drivers of zoonotic diseases is essential for developing effective public health interventions. This includes addressing factors like deforestation, wildlife trade, and climate change that increase the risk of spillover events. Section 8. Prevention is key, breaking the chain of transmission. Preventing zoonotic diseases requires a multifaceted approach that addresses the various stages of disease transmission. By breaking the chain of infection, we can reduce the risk of spillover events and protect human health. One crucial aspect of prevention is reducing contact between humans and wildlife. This includes protecting wildlife habitats, limiting encroachment into natural areas, and regulating the wildlife trade. Educating people about the risks of interacting with wild animals is also essential. Controlling vectors such as mosquitoes, ticks, and fleas is another important preventive measure. This can involve using insecticides, eliminating breeding grounds, and promoting personal protection measures like wearing long sleeves and using insect repellent. Safe food handling practices are crucial for preventing foodborne zoonotic diseases. This includes cooking meat thoroughly, washing fruits and vegetables, and storing food properly. Educating people about safe food handling practices is essential for reducing the risk of infection. Section 9. Early detection and rapid response containing outbreaks. Despite our best efforts at prevention, outbreaks of zoonotic diseases can still occur. Early detection and rapid response are essential for containing these outbreaks and minimizing their impact. Surveillance systems, both in human and animal populations, play a critical role in early detection. These systems monitor disease trends, identify unusual patterns, and alert public health authorities to potential outbreaks. Once an outbreak is detected, a rapid response is crucial. This involves isolating infected individuals, tracing their contacts, and implementing control measures to prevent further spread. Public health education campaigns can help raise awareness about the outbreak and promote preventive measures. Developing and stockpiling diagnostic tools, vaccines, and treatments for potential zoonotic threats is essential for a rapid and effective response. International collaboration is crucial for sharing information, resources, and expertise to contain outbreaks quickly. Section 10. Global cooperation, a united front against zoonotic diseases. Zoonotic diseases know no borders. They can emerge in one part of the world and spread rapidly to others, as demonstrated by the COVID-19 pandemic. Global cooperation is essential for effectively addressing these threats. International organizations, such as the World Health Organization and the World Organization for Animal Health, play a crucial role in coordinating global efforts to prevent, detect, and respond to zoonotic diseases. Sharing information, resources, and expertise is essential for a coordinated global response. This includes sharing surveillance data, laboratory samples, and best practices for disease control. Investing in research and development is crucial for developing new diagnostic tools, vaccines, and treatments for zoonotic diseases. International collaboration can accelerate research efforts and ensure that new technologies are accessible to all countries. Section 11. The future of our health, a call for vigilance and action. Zoonotic diseases will continue to pose a threat to human health. As human populations grow into wildlife habitats, the risk of spillover events will increase. Climate change, deforestation, and wildlife trade exacerbate these risks. Protecting ourselves requires vigilance, research, and global cooperation. We must invest in public health systems and improve surveillance. Educating the public about zoonotic diseases is crucial. By working together, we can protect current and future generations.